There's no other operation that's been shown to improve your quality of life to the same extent with the success rates of hip replacement, which we've been doing now for over 50 years. It's generally an operation that 90% of patients are really happy with, and a small percentage are disappointed for a variety of reasons, sometimes because there's an obvious complication with the procedure, and sometimes because it remains stiff and sore, or it's irritable, and sometimes this leads to further investigation and treatment. But over 90% of patients universally are really happy with hip replacement. The things that can go wrong with hip replacement that might put you in the 1 in 10 group that are unhappy include things like infection, and I'm not talking about an infection of the skin necessarily, which is a problem in itself. I'm talking about a deep infection that has colonized your implants, which means that further surgery is likely to be required, as well as prolonged periods of antibiotics to resolve. And when that happens, the goals of treatment change slightly from looking for a perfect result to trying to eradicate infection, unfortunately. And this will happen maybe 1 in 100 cases that we do, and it doesn't really matter whether this is Ireland or Japan or Germany or the States. These figures are pretty universal despite all the precautions that we take. The other complication that's relatively unique to hip replacement is dislocation. This is where you turn your hip too far in one direction for the construct that you have, and you lever the ball out of the socket. This usually requires a trip to the emergency department, some sedation. We put the hip back in again, and hopefully this becomes the only time this ever happens for you. This happens in maybe 1 to 2% of cases of hip replacement worldwide. A smaller percentage of those, this becomes a recurring problem that leads to more surgery. In putting the implant in, it involves a cup and a stem that are hammered into your bone, and depending how soft or hard your bone is and how hard or soft we hit the implants, occasionally we can crack the bone around your hip, and it can lead to fixation being required, potentially a longer operation, and some restrictions on you afterwards. And even though it's relatively uncommon, there typically is not a long-term implication if that unfortunate event occurs. You may also fall at any time after the hip has been done, it could be years later, and have a fracture around a hip replacement, which will typically require surgery at that time, and it's typically slightly more complex than if you just broke your leg in a fall in any case. The other big problem that people can have after hip replacement is we can make your leg slightly longer or slightly shorter than the other one. This happens more often than people realize and can lead to you requiring a heel or shoe raise on the leg that's shorter, and unfortunately sometimes can only be addressed with further surgery. Sometimes this is on the other hip if that hip is also arthritic. And apart from that, there are medical issues that can happen with any operation, like bleeding, nerve injury, clots in the veins of your legs, clots in your lungs, heart attacks, strokes, and everything else that you can think of. But having said all that, 90% of people get none of it, are happy with the operation and get a good outcome, and get many good years of living afterwards with a pain-free hip. And a small percentage, something goes wrong that requires further intervention, and ultimately most of those patients also end up with a good outcome.